Yeah, we're gonna, so we'll try and nail that down here in the press. Yeah. Well, they probably have a pretty good idea based on the history of when this person came, assuming they got to talk to him beforehand. And he'd pick one before he could come. And again, did you get that map I sent you? Thought that might help. All right. And we'll just plan. Go ahead. I don't have a separate camera, but I am sitting in a location where he can wind down and give me a shot. So I'm going to try that. Okay. Great. All right. Well, we'll do more in a little bit. Thanks, guys. Bye.
Gonna do a mic check for you all. All right, mic check, check 1 2, testing, testing 1 2 3, white balance, mic check, testing 1 2 3, check, check, testing 1 2 3. This is a little bit on the higher end. Check, check 1 2, testing, testing 1 2 3, check, 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 check. White balance if anyone needs it. Is everyone good? Check, check 1 2, mic check, testing 1 2 3. So microphone check, mic check, check 1 2. The golden pipes like you do if you want to keep on.
All right, I got you covered. Yeah, okay, sounds good. Everybody still need a mic check, anybody? You good? Okay. All right. Come on up here, Jeff. We can do a duet. Mic check 1 2 3 4. Here's another mic check for you. 1 2 3 4. I feel like we should be roasting marshmallows or something, or get a little campfire going. Yeah. Anybody got a banjo?
Did you tell them already the B-roll afterwards?
I'm sorry. Okay.
All right.
Go ahead.
Glad we're all cozy. Thank you all for joining us. The governor and the team will do a briefing, and those of you who want to do B-roll afterwards, after the principals depart, if you want to go shoot the medical health coordinating center behind us for shots, we'll do a little tour so you can get that afterwards too. The medical health coordinating center. This is the state's. Maybe there's someone who actually knows what they're talking about, but this is where the state coordinates response to medical conditions. It's like a little mini OES SOC that's specific to medical issues. And so that's where they're doing all the disease tracking, etc. Karen looks skeptical. That's as much as I know.
Hope you guys don't mind, but I'm going to get a class picture. There we go. Nice. As soon as we get the warning, we'll give you a warning. Absolutely. You're happy about that, Dave? Yeah. Why don't you grab your guitar? Come on up here. Everybody good? Everybody have what they need? Yeah? Okay.
Wi-Fi password?
What's that?
Wi-Fi password?
That's an excellent question. Let me see if, are they? Okay. All right. Yeah, I'm just a visitor in this building. I don't know it. One, two, three, four. Hello, 1, 2, 3, 4. Wait, I'm just getting word that it's going to be 3 hours before the governor arrives. I'm sorry, just kidding. Just kidding. That'll do. Perfect. So everybody who has headphones on, does this mic sound a little tinny to you? Could it be a little fuller? A little bit? Okay. It's the first time that we've gotten feedback on it, so, I mean, not literally feedback, but not that. So we're going to try something here. We're going to swap out mics, see if that helps. Well, let me shut that off. Good. Yeah, let's start over. There you go. I'm going to try this mic instead of Phil. Is it going to be too heavy? Maybe. Yeah, wait. Okay. All right. Oh. Hey, Jeff's got a stand over here we're going to try. Yeah.
Is this mic working?
You're getting it? It's better? Really? Okay, cool. All right, thank you, sir. Thanks. This, my friends, is what we call teamwork. This is it's good. I appreciate it. We'll work on getting that mic replaced with something a little better. So the next time we do this, it'll sound better without all the Okay, I don't know whose mic this is. Can you hear me tapping on it? You got it? Okay. All right. That should pick it up. Okay. All right. Okay, so another mic check for as loud as I can. You don't want that, Phil, but I will give you a mic check that I think will approximate what the governor and Mark Ghilarducci and some others will present at. How's that looking? Looking good? Sound okay, everybody? Not.
We have about 15 dB.
Okay. All right, good. Good. All right. We'll do one more mic check at least before we start. Hey, I'm going to take a picture for our Flickr page, and if anybody wants it, that's where it'll be, and you can download it, just for fun.
Can someone check about the Wi-Fi?
I think they are working on that. Jeff, I can't see you. That's good. All right, fine. I'll put that one up there for
Folks,
everybody.
I just
Appreciate
give
it.
a nice solid lane here so people can get in.
Huh? What is Flickr? It's the long forgotten about platform. They still have Flickr. Yeah. It's not live, but no, it's not. It's a filter. You see that? Yeah, that's a filter. I love that.
minutes out, so final prep will.
There you go. So to make it official, 5 minutes. 5 minutes. What? I gave it to you. What are you talking about? It's not up here. That other dude took it. There wasn't much left, by the way. But there was enough. I get it. Okay, final mic check. Final mic check for anybody who needs it. This is a mic check, final mic check. 1, 2, 3, 4. We should be getting started here any minute. Final last words. All right, anybody need a white balance before we get started? I've got the official State of California white sheet. All right, we should be getting started here any minute. That was $47.32. Just one.
Take good care of it. Yeah, make sure it's safe. No place to come on.
Exactly. Switch sides.
Now, where are you going to be?
I'm gonna be right here. Okay. Yeah, I'm gonna be.
Can we ask someone back there about Wi-Fi?
Yeah. Was just told that the Wi-Fi guest network is unavailable. Unavailable. Sorry. Okay, we're working on it, but haven't been able to get that solved. Do you have a hotspot on your phone? No.
Right.
Could you maybe step back just a little bit so I can see the governor? If,
About as far as I can go. Actually, I really can't. That's why I stood here.
You can't switch sides.
That actually probably.
Are you translating for all of us?
I am.
Mark, why don't you guys, so we can get everybody. You guys all get in here? All right, well, welcome everybody, and thank you for the opportunity to update folks. I imagine many of you here situationally to understand what was announced yesterday in more detail and specificity as it relates to the first, apparently, first community sourced transfer of the virus. I want to first, though, contextualize this moment and contextualize California's role as it relates to the issue that is in front of us. I've been very proud to be a resident of this great state for over 50 years. The privilege of growing up in and around San Francisco through the HIV and AIDS epidemic. I saw firsthand the incredible capacity and resolve and compassion, empathy, drive, the innovative spirit that defined our march to meet those moments in the past. How richly resourced we were, not just financially, but in spirit and in resolve. I had the opportunity over the course of decades in public service as a county supervisor and as mayor of a county, San Francisco, to work very closely and collaboratively with the state of California, federal agencies to address issues large and small, issues around MERS and SARS, issues around H5N1, not just H1N1, issues around Ebola and our response to those situational challenges and crises. I saw firsthand the incredible expertise and commitment and resolve of people at all level of government. And as a consequence, many of those things are in our rear view mirror as it relates to the acuity of our consciousness and focus. Accordingly, we'll meet this moment. We will express and advance similar resolve on the issue of this novel coronavirus. And we will accordingly attach ourselves to a little bit of understanding of our history and our capacity to meet pandemics head on, both in pre-planning, both addressing pandemic in real time, and more importantly, in many respects, post-pandemic. Over the course of decades, now the state of California formally has adopted some renewed strategies. And those strategies are advanced on an annual basis through formal efforts at the local level, regional, state, and federal level to work to build capacity and build partnerships. The state of California invests millions of dollars a year to require communities, large and small in this state, to advance protocols, to do very comprehensive annual event plans, and to continue to develop relationships, not just develop policies and planning documents. Relationships and trust, at the end of the day, matter more than anything else. We had a number of those, by the way, conducted at scale last November. It was just a month or so later, last December, that we first were afforded the opportunity to learn more about what was happening overseas in Asia. I'm very proud of being a former mayor of San Francisco with the first and largest Chinatown in the United States, one of the largest Chinese populations, Asian populations, more broadly defined per capita, and they are part of our country, accordingly, being governor of the most diverse state in the world's most diverse democracy, also affords us a capacity of understanding and, again, strong formal relationships that have been developed over the course of decades. Those relationships allowed us to advance in real time an understanding and scoping of the challenge that inevitably would be presented. We worked more formally with the Trump administration and continue to work formally and very collaboratively with the Trump administration at all levels to coordinate and collaborate. That coordination and collaboration, you may recall, initiated in a number of repatriation flights that came to the United States. And rather than turning our backs on those repatriation flights, we supported with partnerships at CDC and other federal agencies those repatriation efforts as American citizens first, as Californians advancing our values second. And we coordinated those first flights, the first flight in particular, in January, late January, down into Riverside at Marsh. We've had a number of other flights, including the most recent at Travis Air Force Base in Solano County. Over 800 people have come in on those flights, but that's a small part of the overall picture. Thousands and thousands of other people have come in on more traditional flights through the state of California. Some 8,400 plus are currently being monitored with 49 local jurisdictions doing those protocols and monitoring as it relates to more traditional commercial flights that came in from points of concern and potential points of contact, particularly in Asia. As you may know, as of today, and I say as of today at this hour, we have 33 confirmed positive tests for the virus. 5 individuals have subsequently moved out of state. So there are 28 people that we know in the state of California that are positive. The case yesterday, understandably, generated a lot of attention, but didn't surprise any of the folks standing to my left or right. We knew this was inevitable as it relates to the nature, the epidemiology, the nature of these viruses, that incident would occur. Accordingly, when hearing about it, we initiated a series of protocols that we were prepared to advance. Those protocols include deep tracking and tracing of individuals that would be in contact with this individual, working again in collaboration and partnership with our federal partners, and working with the extraordinarily talented and committed frontline workers, both in the healthcare sector, but more broadly defined at the local and county level. We are currently in deep partnership with CDC on one overriding protocol that drives our principal focus right now, and that's testing, and the importance to increase our testing protocols and to have point of contact diagnostic testing as our top priority, not just in the state of California, but I imagine all across the United States. We had conversations just, I don't want to say moments ago, but within last few hours with CDC, assuring us that the testing protocols will be advanced with urgency. We have just a few hundred testing kits in the state of California, and that's surveillance testing as well as diagnostic testing. That's simply inadequate to do justice to the kind of testing that is required to address this issue head on. And I'm very pleased that the CDC is moving expeditiously on that and have made firm commitments to the state of California that will significantly and exponentially expand our capacity to advance those testing protocols. Nothing more important than point of contact diagnostic testing that can be readily made available so that we can have full spectrum testing of this disease. And so that is, or rather of this virus. And so that's our top priority as it relates to the moment. And again, we are pleased with the response that we have just received from our representatives, the federal government. We have today, though, representatives from a number of state agencies that will talk more learnedly and more specifically about the protocols and procedures that are underway as it relates to modeling this virus in this state, looking at vaccine protocols, when, not if, when the vaccine avails itself, looking at the strategies of cooperation at a multi-jurisdictional level, be it not just with state and local and federal officials, but also nonprofits, NGOs, and private sector participants. That's why we have assembled here today the head of our Health and Human Service Agency, who will speak just after me. He'll hand it off to Dr. Angel, who represents public health system and someone many of you in California are quite familiar with, the head of our Office of Emergency Services, not to elevate anxiety in relationship to the Office of Emergency Services, but our leader as it relates to wildfires and relating to natural disasters, but also our leader in logistics as it relates to the modeling and gaming out of our next phase strategies if they are necessary. I long-windedly have just said the following. We're meeting this moment. We have been in constant contact with federal agencies. We have history and expertise in this space. We are not overreacting, but nor are we underreacting to the understandable anxiety many people have as it relates to this novel virus. At the same time, no better resource state in America to address this issue head on, and no better team assembled that have taken account and responsibility from day one to meet this moment. So it's in that spirit that I now will ask Dr. Galley to come up and express his points of view, and he will pass his podium on to the two other representatives of agencies, and we're here, of course, to answer any question you subsequently may have. Dr. Galley.
Thank you. Thank you, Governor. My name is Dr. Mark Galley. I'm Secretary for California's Health and Human Services Agency. Today, I want to walk through what we, alongside our colleagues at the Governor's Office, Cal OES, our local partners, our private partners in the hospital system, the clinic system, our many physicians and nurses across the state have been working towards, as well as our great partnership with the CDC and other federal agencies. We are here and have been doing our work around the clock for many weeks and months now to protect California's health and safety since we first learned about the novel coronavirus. I will then turn this over to Dr. Sonia Angel to my right, who is our California Public Health Officer, who is also the Director of the California Department of Public Health, and she will go into more detail about specifics on the particular case that I know many of you are interested in learning more about. I do want to spend a moment just setting a bit of a ground rule around what we'll do here today. As a physician, along with Dr. Angel, we take very seriously patient privacy. We may not be able to be in a position to answer questions about the most recent case when it comes to the condition of the patient, their age, and where they are. We are also not going to be discussing in great detail issues around the federal repatriation efforts. As many of you are aware, we are in active conversations and in litigation around that with our federal partners and the local entities. I want to start by saying it's natural to feel concerned about the novel coronavirus, but I want Californians to know that we have rigorously planned for this public health event. Just like this, as the governor mentioned, when I was with him in San Francisco, we prepared for the H1N1 situation. We've gone through this with Ebola and being prepared, and many other events like it in the past. And our goal is to take every precaution to protect California's health and safety. This is a rapidly evolving situation. We are leveraging all the necessary state resources to address it. We are in constant communication with our federal partners. And yes, it was just moments ago that we were on with the CDC's director learning about our ability to expand testing here in the state, to receive more testing kits, and to be in active conversation on redefining what triggers a situation, a clinical situation, to be tested. California continues to be an active partner with the federal government, helping lots of impacted Americans get home. As the governor said, We welcomed home the first of many flights to the state. We have been participating with all of our public health resources, our clinical resources, to support those federal efforts. We are the first in the nation to begin to roll out testing, and we are going to be expanding that in the hours to come. We have been actively and extensively planning with our local health partners. That includes our delivery system. The hospitals and doctors and nurses that we all trust have been deeply engaged. I'm grateful for those wonderful partnerships and relationships we have with those agencies and organizations across the state, because those relationships matter at a moment like this. It makes it more seamless and gives us a better chance to be prepared, as we have experienced in the last many weeks. As in any public health event, our Medical and Health Coordination Center has been activated and is coordinating its response across the state and preparing for more and possible community transmission. California continues to prepare and respond in coordination with even our local hospitals in Solano County and in many other counties that have stepped to the plate and really taken on a clinical load that weeks ago wasn't anticipated. We are providing information, guidance in documents and in technical assistance in regular phone calls and webinars with all of our state partners who need to continue to work with us to make sure that we have the best interest of all Californians in mind. This includes guidance to facilities such as schools, universities, colleges, child care centers, all across California, because the questions are many and we want to make sure we give a consistent and clear voice. We continue to coordinate with the federal authorities and local health departments in implementing screening, monitoring, and in some cases quarantine. We've had over 8,000 passengers returning to the U.S. from China and other parts of Asia over the past many weeks, and we have supported and worked with our local health departments to make sure those individuals are safe and that we are giving good and appropriate guidance based on the most up-to-date information. We are continuing to work with our federal partners on giving our feedback on all of their guidance and criteria so that we make sure that it is current and meets the needs of an evolving situation. We look forward to continuing those strong relationships, and we are working hard to ensure that our local health capacity is preserved for those individuals with significant symptoms if that is developed. So we are working hard to make sure that our local health partners are communicating accurately when people who are experiencing symptoms, whether they've had exposure or not, should be emerging and coming forward to health facilities. We live in an age where telehealth, telemedicine, phone advice, many other types of modes of getting information and sharing your clinical condition exist, and we are urging many folks to use that before they come to emergency rooms or urgent care centers or their physicians' practices, in order that we ensure that the hospitals and our capacity during a important time in flu season and when other emerging other patients with clinical needs would naturally use the emergency rooms. So we're trying to work hard with those partners to make sure that we use our scarce but critical access within our acute care hospitals in the most responsible and appropriate manner. I will now turn to Dr. Sonia Angel, who will go to more detail about the sort of state of affairs of coronavirus across the globe, across the nation, in our state, and some of the specifics on the important development from yesterday. Dr. Angel?
Thank you. Hi, good morning. I'm Dr. Sonia Angel. I'm Director of the California Department of Public Health and State Public Health Officer, and I'm welcoming you all today here to our Medical Health Coordination Center. This is where we coordinate with all of our agencies a very important response that we've put in place for novel coronavirus, otherwise known as COVID-19. Novel coronavirus, COVID-19, is new, but it is part of a family of coronaviruses that have been around for a long time and that we are very familiar with. In fact, coronaviruses are responsible for the common cold. So it's something that all of you may also be quite familiar with. The cause of the current outbreak that originated in China is a new member of this family. The most common symptoms of COVID-19 include fever, cough, and shortness of breath. Our experience to date, though, is that most people, more than 85%, will have mild or no symptoms. Some may move to a more complicated course, including pneumonia, but that is not the most common manifestation of novel coronavirus. We're learning more about its transmission, and as I said, the most common symptoms are respiratory. Therefore, its primary mode of transmission is from coughing or sneezing, particularly when we don't cover our mouths after we sneeze or cough or don't wash our hands. There have been a limited number of confirmed cases of COVID-19 in California to date, as mentioned. 33 positive cases in California, 24 were from the repatriation flights. The other 9 confirmed cases include 7 that are travel related, 1 due to person-to-person contact, but that was from a very close contact, a spouse living in the home, and now, as mentioned yesterday, this new case from an unknown source. This particular case could be the first possible instance of community transmission of COVID-19 in the United States, and it's here in California. It's in an individual in Solano County who is receiving care in Sacramento County with no travel history and no known exposure to somebody with confirmed COVID-19. We currently have people in the field working in the community at the local, from the local, the state, and also from the CDC. They're investigating the cases and they're taking action. They're contacting any individuals who might have been exposed and they're isolating them. This is a fluid situation at this time, and I want to emphasize that the risk to the general public remains low. In the event that that risk changes, we will communicate with you. We will make everyone aware. But it's important to note that the risk to the general public in California remains low from novel coronavirus. The Department of Public Health's Emergency Operations Center has been actively coordinating response efforts, preparing for possible community transmission. As always in emergencies, we plan for both the worst situation, but also the best situation. So we're ready for anything. We've been working with our state and local partners for situations like this for over a decade. We've updated our plans based upon our lessons that we learned from H1N1 and from Ebola virus. But we do realize that this case that we're discussing today marks a turning point. And as such, we're expanding our surveillance activities. We're increasing our laboratory capacity, as mentioned, with more testing. We're planning increased demands on our medical system. And we're using the latest science to model and forecast the needs of our community so that we are sure we can continue to respond as we have to date. As we learn more about COVID-19 and how it evolves, we will be sure that we adapt whatever we're doing to make sure that our responses are appropriate. And as we continue to work in coordination with federal and local partners, there are some simple steps that I want to remind all of you, we'll all emphasize this, that you can do today to make sure that you stay safe and to protect yourself. And those include washing your hands with soap and water, avoiding touching your eyes, nose or mouth with unwashed hands, staying at home from work or school if you become sick with respiratory symptoms like a fever or cough, and avoiding close contact with people who are sick. It's natural to be concerned at times like this, which is why California officials have been closely monitoring and working with partners around this situation. Now I'd like to turn this over to California Office of Emergency Services Director Mark Ghilarducci.
Thanks, Dr. Angel. Good morning, Mark Ghilarducci, Director of the Governor's Office of Emergency Services. First, let me just say, as you've heard today, this is a new and rapidly evolving situation and a challenge to us, but we are doing everything at the state level in support of our local partners to address it. This is not our first time, as has been mentioned by previous speakers, that we have addressed similar kinds of challenges. Currently, my office, the Office of Emergency Services, is primarily supporting the great team at the Health and Human Services Agency and California Department of Public Health with all any resources, coordination activities, and we're actually leveraging all the very powerful and broad authorities of OES and of our great emergency response system to be able to meet whatever needs that HHS has to ensure that they have all the items they need, particularly like areas in commodities or critical assets that may be necessary. We're also doing a lot of cross coordination and communications with jurisdictions around the state to ensure that our local operational areas meet all the needs in the event that they're having trouble facing whatever challenges that they face. Again, much like we do in the normal course of emergencies that we routinely face here in California. And like all emergencies, it's critical to understand that there are risks. And as has been mentioned, we want to encourage everyone to have a family plan and review that with your family. And really listen to state and local health authorities as they continue to provide critical information out to the public. This is going to be a little bit of a marathon, and so we're going to be continuing to support. And as it evolves or changes, we'll be prepared to do that in an effort of bringing all different state agencies and departments together where we're doing advanced planning for any potential scenario that may take place in the coming weeks or months. So again, I just want to close by emphasizing that while we face this new challenge, we need to know that the state is taking every action, and we want to encourage you to just continue to listen to your state and local health officials. Thank you.
Thanks, Mark. So happy to take any questions, and again, with the one criteria of respect and responsibility that we have to patient privacy. I imagine many of you want to know who she is, how many people she is in contact with, where she works, and those clearly are understandable questions, and I hope you, in anticipation of our responses, understand our patient responsibility to protect and preserve confidentiality, but know that we are intimately involved in answering those questions with the kind of specificity that's required of the moment.
Governor Jody Hernandez, NBC Bay Area. Can you tell us when this person came to the Northern California hospital? How many days went by before they came to the medical center and, were possibly exposing folks?
Yeah. I leave that to Dr. Galley.
We can't give all of the details that reveal that. We know that there were a number of days that she was in her community and that she then did begin accessing care. And through the course of her care, as her condition evolved, she was then tested. So there were days in between when she emerged with symptoms and when the test actually occurred. But we have been working closely with those healthcare delivery systems that took care of her, as well as the CDC and others, to make sure we're doing all the appropriate things to understand what community exposure existed and what we can do to make sure those who were exposed receive the right care and concern that we would want any of our family members to receive that were in that situation.
I should just note, it underscores the importance of the testing protocols being advanced. And as we said, the information we received from the CDC this morning advanced those protocols. And so we are satisfied and we're now moving in the right direction. Accordingly, we have a tracing protocol that's best in class, meaning every single point of contact, every point of contact of those that were in contact, all of those will be resourced and reviewed. Accordingly, CDC has committed to sending 10 of their personnel into the state of California to help assist in those efforts to broaden our capacity to track each one of those individuals and to make sure that they're contacted and to make sure that they're interviewed.
Governor, let me ask you, there were many of the passengers from the Diamond Princess were brought to Travis Air Force Base in Solano County. Many have tested positive. That's where this patient first presented. Is there any connection?
Leave that to, my medical team.
We have no evidence that there's any connection with those patients and this individual at this time.
Okay, and you're also tracking a lot of individuals. how many potential contacts are you tracking right now?
I can't give you those specific numbers, but I can tell you that investigation started yesterday. They continue across the full spectrum from the individual's home all the way through the hospital system, and all of them are being reviewed carefully by those people in the field at this time.
Characterize it, dozens, hundreds?
I can't give you the number at this time.
Can you explain why the state wasn't prepared with more testing kits?
Well, no state was. No state had the ability to access them. Well, I don't want to get into the, but let's just establish this. New protocols are now being advanced. They can't happen soon enough. Testing protocols have been a point of frustration for many of us across the spectrum, and I mean, means across not only spectrum within the health system, but across states. We have, as I said, just 200 kits, and that's for not just the traditional diagnostic, but also surveillance. It's simply inadequate. But no longer will that be the case. Later this afternoon, tomorrow, next few days, we have been assured of our capacity to significantly, exponentially increase the capacity to test. And this is something that, again, is critical at this moment.
So, Governor, has the federal government been too slow to respond? I mean, UC Davis
We've
tried
been-
to test that passenger last week.
I don't, look, I'm not going to politicize this moment, and I'm not going to point fingers. And I'm going to speak honestly and forthrightly that we have had a very strong working relationship with the administration. From the secretary level to the director level, we have been in consistent contact, not only as a team, but individually, I have as well, from day one. And to the extent that they are processing their own protocols and procedures, we are grateful that in that iterative engagement, they are moving forward as we demand in advancing our efforts to test.
Governor, with this current challenge, will you declare an emergency? Because it is a challenge.
To the extent necessary, emergencies often are to emphasize energy of focus, often just for federal purposes of receiving additional resources and support. Right now, I don't feel either are necessary. The attention is understandably focused. The money is not the issue at the moment, but to the extent conditions changed, we'll consider that.
Governor, with everything going on, how concerned are you about proposed cuts to the CDC?
I'm not concerned about them at all today. I was very concerned about them a week or two ago. I don't think the issue of money now is going to be an impediment. I think there is a deep sense of urgency and recognition that we need to provide the kind of resources to meet this moment. So no longer am I concerned.
Following up on that, you mentioned that relationships and trust matter more than anything. Do you trust that President Trump is taking this seriously enough?
I know his team is. I know the folks that came up after him in the press conference. We know each and every one of them, not just by name and face, but by constant contact. I know each and every one of them are sincere and resolved, and so I have absolute confidence that the folks he's assembled around him do.
Governor, about President Trump himself?
We'll see what he's able to accomplish in the next few days and weeks. And but it's all about your team. It's about the people you assemble. And he's got long-term professionals that have transcended his administration that are there, that have earned reputations that are solid. And we have developed relationships of trust, and those relationships predate his administration and mine. So from that perspective, not a lot of daylight. Again, I'm not here. It's very easy for me. I mean, we're involved in 68 lawsuits with the Trump administration to find daylight and politicize this. But first and foremost, I'm an American citizen. I'm a father of 4. Politics has no place at this moment. We have to meet this moment with a sense of urgency and conviction that transcends politics and transcends pettiness. And so I will not allow my administration to participate in that, and I hope we collectively can elevate above that.
Governor, you said more kits are on the way, or testing kits are on the way from the CDC. When will they get here, and how many kits are expected?
Well, That's a real-time
Sure.
question.
We spoke to the director of the CDC moments ago, and he assured us, without giving a specific number, that our capacity would be substantially expanded. We expect that those kits will be here any day now, and we already have a number at the moment, so this will just augment that capacity and scale very soon.
Are there more clinicians who have requested that their patients be tested, but they haven't because they haven't fallen into the narrow protocols?
We don't have that information. We do not know if that's actually the case. But as the governor said, we are in constant communication, and the case from yesterday is obviously giving the CDC a lot to consider in terms of revising those protocols so that more individuals will be tested with symptoms that might be identified as common pneumonia without a clear source. And we are in conversation with the CDC about ensuring that that fits the need for California so that physicians or clinicians who ask for the test will more easily be able to send it.
Doctor, you mentioned that this woman spent some time in the community before she recognized any of these symptoms. What specific community are we talking about here? Who should be concerned?
Yeah, so as both the governor and Dr. Angel said, we won't be speaking about the specifics, but because we have
people deserve to know if that individual was in their community.
We have a very robust and first-class tracking system to ensure that we're reaching out to all of the potential contacts in many, many different walks of this person's life so that we're doing, as we have in many, many other situations like this, to ensure that those individuals who may have been at risk are contacted and that they receive the correct attention and care if needed.
But you don't feel the community deserves to know?
As we said, we're engaging closely with that community, and in order to protect a number of things around the public health standards that we're all committed to, that we are working hard to make sure that anyone who might have been in contact with this individual throughout the community is knowledgeable, and that we're reaching out to them.
And let me just amplify, if I may, just briefly amplify. Absolutely, people that have been in contact with this individual have the right to know, and in real time, they are being interviewed. Points of contact, family members are being interviewed, and others. This is a very detailed protocol that is well established, that predates this particular virus, and it is a protocol that is multidimensional, and I think affords a level of comfort that people understand we're meeting the moment in a comprehensive and detailed way.
But this is under the assumption that someone else in this community transmitted this disease to that individual. We don't know who that person is. So should people who didn't necessarily contact the sick person know that there are other people in their community who may have this disease?
Yeah, but look, that's the reason the testing protocol is so important. You don't know what you don't know unless you're testing. And so this point cannot be emphasized enough. We should have caregivers, doctors, have the capacity in real time, on demand, to advance these testing protocols. And that's, I think, that's why I began this conversation today with all of you, that's our top priority. It was this morning, and we've been given assurances that CDC recognizes that with a deep sense of urgency. As you know, it's one thing just to have the testing kits. It's another to have the capacity on the back end to adjudicate the facts and have a full diagnostic test that's provided. That's limited today, but over the course of the next few days, we've been given assurances there'll be exponentially more sites for testing also made available, including the prospects of doing them within the state of California so we get the test results back more quickly.
Should everyone in Solano County be concerned?
Look, everybody in this country is rightfully anxious about this moment. But I think they should know that we are meeting this moment with the kind of urgency that is necessary. And I don't want to overextend the anxiety that people naturally face. That's common sense. This is something that we're organizing around, something we've been organizing around for months. Nothing so far has surprised us. Nothing. What happened in Solano County did not surprise anybody. I think the only thing respectfully that surprised folks was that it didn't happen sooner. But we had anticipated this moment. It's a natural thing. And invariably, we'll meet it. And so I think people should go on their day-to-day lives with some common sense And I think Dr. Angel was right to advance what common sense. It's nothing more complicated than what your grandma taught you, what your mom taught you, and others. But I don't want to instill any sense of new anxiety that already isn't naturally filtering through our communities.
Since the virus can be spread.
I'm sorry?
Do you agree with moving patients to Costa Mesa, and are other sites under consideration?
We are in litigation, as you know, in real time on that. I think both parties are meeting, representatives, lawyers from both sides. So I don't want to speak to the specifics of the site in and around Costa Mesa community. But we clearly have protocols, and we have pre-identified locations, and that's among the more favored location in the state. But there are other sites in addition to that site, all across the state. All across the state. It's a number that's very dynamic. We estimated it, candidly, forthrightly, to be higher than it turned out to be, meaning the test came back more favorably. And this is something that's encouraging. Less people testing positively than we had anticipated. So we had some initial estimates of what we needed that actually are substantially more modest. That said, this is dynamic, and things could change the next days and weeks. And so a big part of why the Director of Office of Emergency Services here is we have protocols that are well established as it relates to emergency planning and how we address people that not only could shelter in place in some respects and be quarantined at home, but also those that need stepped up support, be it in hospitals, but also in non-hospital settings, so that we don't clog our hospital system and not provide access to those that are in desperate need of emergency care and other acute care.
Governor, you and the Secretary alluded to this, but do you specifically think the guidelines for testing need to be expanded? And he mentioned something that's happening first in California, but could expand on that.
Yeah, no, look, as I said, I can't repeat it enough. We need to substantially increase access and availability to testing, and we need to do that today. And the guidelines, as it relates to the testing, I'll leave to the doctors and the experts, but I can assure you, I think we all share that sense of urgency that the testing protocols need to be improved.
So in conversations with the CDC today, we are assured through our feedback and feedback from a number of other states and jurisdictions that those requirements for testing will be changed based on the new information from yesterday here in California. And we are working hard with the CDC to ensure that once those are prepared, we are ready for it. We know that it will shift from the posture of border and significant containment to one where we acknowledge that community spread is possible and that it meets that condition, so that patients where the provider believes there are symptoms suspicious of coronavirus, that we have the capability and permission to be able to send that test.
I think about what kind of notifications people in Sonoma County are getting. People are getting reports, getting emails, text messages. What is the general public hearing about this? I mean, they're talking about schools that are wiping down desks. What is the general public getting out of this?
Dr. Andrew?
Sure. So the contact tracing itself and the way we communicate depends upon the individual and how we can best reach them. So that can vary in different methods. So that's the first answer to your question. With respect to schools and other locations, that really depends upon where we understand there might be a particular risk. And so that, again, will be evolving over time.
Do you
But
plan
is
to
this
release?
going out to the community at large, though, or only specific people being contacted?
The way contact tracing works is that we start from the individual that we know has been affected. We have interviews with all of those individuals that are around them, and step by step, we look at where they've been, and who they might have been in direct communication with. We also know, because this person was admitted to the hospital, that we also look at all of those individuals in the hospital who might have been in contact with the patient there.
But I just want to be clear in terms of that, though. There was nothing that went out blanket to the community. If someone got contacted, it was part of the contact tracing, not a general emergency alert on their phone or something?
No. These are personal and direct to the individuals and very intentional because we really want to make sure that we communicate to those individuals the potential risk that they have when we identify it. So these are not blanket statements, they're very specific.
But do you plan to release a timeline of where this person has been?
In a grocery store, for instance, and you don't know all the people that she might have come.
Guys, I can, having had the privilege over decades now, not just in this instance, these protocols are well established. This is not our first great challenge as it relates to public health. Quite the contrary. These protocols have been perfected in so many ways, shapes, or form, not only in the United States, around the rest of the world. So all of those things are being considered, I can assure you. And we have not only existing teams and protocols in place, they are now, as I suggested, being expanded by the CDC themselves that are helped amplify those efforts. And as information becomes appropriate to make available in a way that doesn't overly create anxiety and, okay, I mean, guys, let's put this in perspective. I know there's deep anxiety, but let's put it in perspective. As we feel it's appropriate for public health purposes, we'll make all of that available. I am deeply committed to transparency, and I'm deeply committed to building trust. And so we're not going to hold things back inappropriately or politically. There's no happy talk here. I'm not trying to talk something up or situationally worry about the politics of this. We are dealing with this as a public health issue. Above all else, that's our frame and focus. And people, again, should know we're on top of this.
You're saying for them to trust you, but there seems to be a resistance up there among you guys to say where this individual has been and when. Why is that?
For all of the reasons I just stated.
But there are concerns about healthcare workers being exposed both at Davis and at the First Hospital.
Correct. And we are aggressively working with those caregivers. We've identified the vast majority of them, and to the extent they had contacts, they are being identified in real time. These are the pros and professionals, and most of them are self-identifying, and we have procedures in place. And again, remember, quarantining people, isolating people happens all of the time. From measles to TB, these protocols are well established. As I said, H1N1, all these other challenges we've had in pandemics in the past, these protocols have been advanced, and these are similar strategies for engagement that we've had and protocols that have served us well, both from public confidence perspective and from a public health perspective.
At the first facility.
You better believe it. Every point of contact
Is that facility
has now
accepting
been.
patients?
We are. Well, I believe they are accepting patients.
Which hospital is it?
Additional testing kits that you expect to get? Has the issue with early faulty tests been resolved, and are there sites in California that you expect?
Not fault. I wouldn't categorize them as faulty tests. Just inaccessible testing protocols, and so we are getting. We have just received, as I said a few hours ago, assurances that tests will be forthcoming, additional test kits. Again, 200 seems remarkably inadequate. Of course, the real inadequacy was not just the lack of test kits, it was lack of ability to utilize those test kits. Now we'll be able to utilize them, and we will be the recipient of an exponential increase in new test kits. And then more testing locations will be made available, so we don't have to send everything back to CDC headquarters in one testing location. We'll see multiples of locations over the course of the next few days. I'm not worried about money.
What about the state?
I'm not worried about resourcing this response. It's just not even a concern. We will meet this moment. We are well resourced as a state. California, for those of you not familiar with the state, is running record reserves and running surpluses. We are uniquely resourced in California, and I have great confidence that the administration, particularly in partnership with Speaker Pelosi and leadership in the Senate, will provide more than adequate resources to the state of California and other states.
Thank you all. Thank you.
We've heard places like
Thank you
LDS
both.
are actually running short on some supplies like masks. Can you talk to that?
Yeah, and I'll end on this because we can spend the day together. You've got a lot of work to do, as do we. As it relates to the masks, we have millions of masks. Some have expiration dates, and we're making a case. Some of these masks have been well stored in secure, cool facilities, and those expiration dates that do not exist in other parts of the world should not necessarily apply here. We have orders for masks. This shouldn't alarm anybody. The masks, of course, are produced disproportionately in China, and so there's backlogs on those masks, but we have millions of masks in storage locally, and we are requesting some capacity to distribute those, and we feel confident that we'll be successful. So we'll have adequate supplies, and I think anything you're hearing in that space is accurate and inaccurate because of the totality and the magnitude of what we have prepared for in the past that we feel confident we can resource going into the future. Remember, no, I leave that to the doctors, but I'm not walking in here with any masks today. Dr. Galley isn't either, but perhaps you can end on that note.
Sorry, can you repeat that?
Do residents need to be wearing masks right now?
We do not believe so, and as soon as that decision would change, we would share it with the public widely.
And if you have
Thank
follow-up
you.
questions, feel free to reach out our respective communications offices. Thank you all.
Where this patient
Thank
showed
you.
up?
Thank you, guys.
Every year, there's a new virus, a novel virus comes out, H1N1, West Nile, etc. They come out and there's a new big thing. Eventually, it turns out that they're not effective, and as they become a part of the regular review, if you will, of the section.
Okay, now that being said, is there a plan for?
Yeah. So
tell me about.
We have massive prevention effort undergoing that started back when the first cases were occurring in our health department every day, several times a day. We're on conference calls with the CDC and the California Department of Public Health. We're enforcing all the quarantines of people who are tested positive in Sacramento County or who are potentially at risk, potentially exposed. And so we're also doing the contact tracing where we follow a case backwards to find out who or where they've been to see if anybody's been exposed.
Well, this case was kind of concerning because we don't know anything unless the person didn't travel, right?
That's right. The person apparently did not travel. It is, as far as we know, the first community-based case which is basically not associated with travel. That being said, it's unquestionable. It's without doubt that we'll have more cases in the community in general as more people are exposed. But again, keep in mind that 81% of cases in the country and around the world so far have been mild or without symptoms, and so that's likely to be the case with most community cases as well.
What is our relationship with the CDC? I heard that they
Terrible it is. So the CDC, the way things work, is we will get notified in Sacramento County Department of Public Health. We'll get notified if there's a case that should be tested by a physician or by a hospital. We go out and test the person with a nasopharyngeal, nose and pharynx swab, or an oropharyngeal swab, and that is sent by courier to the CDC in Atlanta overnight. There's a 3 to 4 day lag between when the test is taken to when it's reported as positive. So we've been working very closely with the CDC and the California Department of Public Health in terms of contact tracing in this case and in the other cases.
So the CDC did look at this particular case, or they did look at this case? That's okay.
I should say that as we get more cases and as more of them are mild and without symptoms, more and more people will probably not get tested directly, just like the current state of the flu. And so we will no longer be putting out individual cases and the specifics about them, but rather we'll have cumulative caseloads posted on our website as more and more cases.
And finally, what should people do as far as this goes?
So this really should be addressed kind of in the way that was major flu season. This is a virus, it's a respiratory virus. It's spread by coughing, aerosolized droplets. It's very much like the flu. The flu, the best messages to do to take the flu are the ones that we should be undertaking in this case, and that is wash your hands, wash your hands, wash your hands. Cough until the tip of your elbow, cough until a tissue, wash your hands, have alcohol, Purell, etc. to wipe your hands with. And if you're not sick, try to avoid places where there are sick people, i.e. doctor's offices or emergency rooms, and unless you're very sick, in which case obviously go to the emergency room. And if you have a sick kid or a sick adult, stay home from work, for instance, in school and work.
Okay, is there anything I left out? I noticed you have your notes there. Is there anything I have left out? I was more concerned with everybody. It's all common sense.
Yeah, it is. The bottom line is with viruses, we cannot use an antibiotic because that only works against bacteria. And then usually immunization is necessary what we need to.
But if you're sick, what should you do? Stay home?
If you're sick, stay home. If your child's sick, stay home. If they have only mild symptoms, it's best to keep them at home. If anyone has major symptoms, major fever, major cough, bad headaches, bad GI conditions, and you should talk to your doctor.
And lastly, these things are kind of seasonal. Will this thing work itself out as the weather gets warmer?
It probably will.
Yeah.
It will probably ease up as we go along, just like the flu season normally does. It's a respiratory virus that's spread by close contact, and so part of the reason that these viruses ease off as the weather gets warmer is that people are out more playing, are out and not confined to closed areas as much as they were. So it's likely that it will be easing off as we go along in the summer.
Does allergies play a part in anything at all? No. That's it. Great. Thanks. Let me reset you here. How you feeling these days? Doing okay? Besides the other thing?
Yeah.
I remember talking to you last time.
Yes, I remember.
Yeah.
Where are you? How long have you been at Channel 3?
35 years.
Yeah, I think I told you I was here. That was right when we left to move back east.
Yeah.
I grew up here.
Well, thanks a lot.
Thank you very much.
Thank you.
Sorry to be out of order
no
here.
worries, no worries.
Okay. Okay.
Yeah.
Okay.
So, we're thinking about 5. Okay.
Nope. I'm fine. Who are the other folks?
We have Alex from the B, and then Mike Plunk from KSBK.
Okay.
Okay, we're gonna be